Welcome to Please Me, the award-winning sexuality podcast bringing you bold conversations and unapologetic big clit energy. I'm Eve, your host, and I'm thrilled to announce that Please Me is now the #1 sexuality podcast in the USA. This show is all about reclaiming pleasure and rewriting my narrative from trauma to sexual liberation. Join me and my guests as we dive into conversations around orgasm equality, self-love, body positivity, and essential sex education. Let's reclaim pleasure and close the orgasm gap, one empowering conversation at a time. Did you miss last week's webinar, Painful Sex No More? How to connect, heal, and love every minute? If you're experiencing painful sex, this powerful session is a must listen. Learn practical ways to eliminate pain and reclaim the pleasure and intimacy you deserve. Catch the replay and start your journey toward pain-free, connected intimacy today. For the next couple weeks, I'm sharing exclusive webinars I've hosted live on SDC.com, the top ethical non-monogamy dating platform and a leading source for alternative sex education. Sponsored by the Please Me Health Collective, these free monthly sessions explore sexual health, pleasure, empowerment, and biohacking for sexual wellness. Join the Please Me Health Collective, my dedicated group on SDC.com, where our community comes together to learn, grow, and connect. Check the show notes for a free trial code and check out my next free webinar, A Gift from Me to You. A huge thank you to everyone who's rated, reviewed, and shared Please Me. Because of you, we're now the #1 sexuality podcast in the USA. Your support means the world and continues to amplify these essential conversations around pleasure, healing, and empowerment. Keep the love coming, leave a review, share your favorite episode, and help us reach even more listeners around the globe. Prefer to read? Subscribe to my newsletter on Substack for exclusive updates and more Please Me related news. Today's webinar is titled Rock Hard Wood and Wetter Sex. Please Me is for mature audiences, so sit back, relax, and surrender to the pleasure of Please Me. ASN Lifestyle Magazine is your go-to source for sex-positive, sophisticated content covering everything from the swinger lifestyle and adult entertainment to intimacy, wellness, and more. You can read every digital issue for free, and subscribers get access to exclusive content. See the show notes for the link to subscribe and check out their Instagram. I'm excited to share that I now have a monthly column in ASN called Big Clit Energy, a Please Me series. Don't miss it and subscribe today. Okay, so we are recording here, and I'm looking forward to having this conversation today. When sexual function goes wrong, and then my other title was Rock Hard Wood and Wetter Sex. And so I'm excited to bring that to you today. I am here live on SDC.com. I'm also recording just for my own purposes so I could use it later. I have a Patreon subscription available where all of my live webinars are. So I'm going to be talking about that as well today. So excited to be here today with you guys. And I'm just hoping that we have some more people jumping on. So I'm just going to ask that you let me know where you're coming from. I personally am in Wellington, Florida. That is where my practice is located. And I'm going to tell you all about that in a few minutes. So if you could, in the chat room, please let me know where you are coming to me from. And I would love to welcome you. Where are you from? Okay, I want to also make sure that you guys can hear me, that the sound is working well. So let me know, give me a thumbs up if you can hear me. And we're going to be starting the webinar in just a couple minutes. I just want to make sure that my sound is good, that you guys can hear me. So let me know if you can hear me over here on SDC.com. Okay, thank you, Lexi. I think I did it right this time. I couldn't remember how to access that. So I have to go to my little flyer first, and then from there. Okay, I found it. I couldn't find the buttons. They weren't popping up, and suddenly, now that I did it that way, it worked. So thank you for reminding me. I appreciate it. I think we are already recording here on SDC.com. I'm glad you can hear me. Perfect. I think we are ready to go. And I'm hoping that as we go along, people are going to be jumping on. And so I'm excited to be here today. My name is Eve Hall. I am a licensed physical therapist, and I treat conditions of the pelvic floor, and I treat sexual health conditions. And a lot of times people think of physical therapy and the pelvic floor, and they don't really necessarily think about sexual health. But all pelvic health conditions are sexual health conditions. They go hand in hand, because if something is affecting your pelvic floor, it is going to affect your sexual health. So I like to consider myself the physical therapist that treats sexual health conditions. And those conditions can be anything from erectile dysfunction to decreased vaginal sensitivity and dryness. And so I'm going to be talking about those conditions today. And welcome to this webinar called Rock Hard Wood and Wetter Sex. And this is going to be a lot of fun. I want to make sure that it's interactive. So please ask me questions, and I will be sure to answer all of those questions before the end of the hour. Okay. So I'm just reading as we go along here, and sometimes I get a little distracted by the chat, but I will try to make sure I keep track of it as we go along here. I also have a podcast called Please Me, and it is a little over a year old, and I am proud to say that it is in the top 2.5% of podcasts in the sexuality profile or category, top 2.5% globally. Okay. And so I know that a lot of people are listening to me from all over the world, which is so exciting. And another reason why I absolutely love SDC.com as a platform, because we are a global site and we are active in a lot of different countries, which is so exciting. So if you're listening to this outside of the SDC.com profile and you're interested in joining SDC.com, please reach out to me and I can share with you my link so that you can get a free trial membership. And of course, SDC is the premier ethically non-monogamous website for dating and education regarding sexuality, sexual health, and alternative ways of coupling. So I am so happy to be here with you today to talk to you about treatment and some information that I know very well, because these are things that I treat in my practice. So like I said, I'm a licensed physical therapist. I treat conditions like erectile dysfunction. So let's talk about erectile dysfunction. There are a lot of different things that people don't realize are erectile dysfunction. So let's just get into that a little bit. So premature ejaculation is one of those symptoms that it goes hand in hand with erectile dysfunction. So if you have experienced premature ejaculation, or you have a partner who has experienced premature ejaculation, this is maybe a webinar that you can share with them, because it is a condition that goes hand in hand with erectile dysfunction. It is a precursor to erectile dysfunction, and it goes hand in hand. Erectile dysfunction is, of course, the inability to get an erection in order to penetrate your partner. And, it's multifold, I'll say, erectile dysfunction. Of course, there's psychological factors that go into it. Sometimes I hear people reaching out to me saying that in group settings, they have some dysfunction, but one-on-one they don't. Oftentimes that's a psychological factor going into it, because maybe you're intimidated, or maybe you're feeling nervous about performing in front of other people, and, having to perform on the spot, especially when other people are around or watching or participating as well, can be very nerve-wracking. So I can understand why that could be the case. What I treat in my practice is the physical manifestation of erectile dysfunction, which is blockages in the blood vessels in and around the genitalia. And those blockages, what happens is not enough blood flow can flow to the penis and the surrounding tissue. And so the penis is not filling with blood properly. And then you're not able to have a hard enough erection in order to penetrate your partner. And so I do a treatment called Acoustic Wave Therapy, and I'm going to get into the details about that in just a few minutes. But I want to first, before I do that, talk about the female equivalent of erectile dysfunction. And oftentimes people don't realize that there is a female equivalent to erectile dysfunction because we don't think about the vagina and the clitoris and the vulva needing blood flow. But they absolutely need blood flow in order for the woman to be ready for penetration. And what that is called is becoming engorged. So the clitoris needs to become engorged in order to have, sex that's pleasurable. Okay. Yes, of course, you can have penetrative sex without having engorgement. But what happens is the tissue is not ready, it's not wet enough, and it could cause pain. And so a lot of times people will have painful sex, or women will have painful sex, not knowing that they need to prepare their vulva and their clitoris and their vagina for penetration. And typically it takes 20 to 25 minutes of stimulation for a woman to be prepared for penetration. So if you're jumping right into the penetration, you're missing out, and possibly causing your partner pain. So that's something to think about, to really stimulate the area, to increase the blood flow to the clitoris, vagina, and vulva. So same thing happens. It's interesting because the same thing happens in with erectile dysfunction that happens with decreased sensitivity and dryness, and that is the female equivalent of erectile dysfunction. What happens is when the blood is not flowing, the way that the vagina and surrounding tissue becomes wet is by the blood flowing to the area. And when the blood flows to the area, the plasma from the blood seeps through the walls of the vagina and surrounding tissue and makes it wet. Okay. So if you don't have blood flow to the area, you're not going to have plasma going to the area that can seep through and wet the vagina and surrounding tissue. So it's extremely important for women to also have proper blood flow. Okay. And also to prepare the woman physically for penetrative sex, you need 20 to 25 minutes of stimulation externally. External stimulation, okay? So clitoral stimulation is what women need in order to orgasm. Only 3 to 5% of women can orgasm from penetration alone. So if that's you out there and you can orgasm, from penetration alone, more power to you. That's amazing. But 95% of women need external clitoral stimulation in order to orgasm. And so thinking about that when you are trying to pleasure your partner is very important, because we all want to make sure that both parties are enjoying themselves fully. Both parties or more, right? All right, so I'm going to go back and read all of the notes at the very end. That way I'm not distracted by them. So there is a treatment that I do in my practice. And again, my physical therapy practice is based in Wellington, Florida. I also do health coaching, and I do coaching regarding sexuality, sexual health, couples coaching that I can also help you with if you're having any of these issues or any others that you want to discuss. But my practice is based out of Wellington, Florida, and this treatment is a treatment that you have to do in person. So coaching can be done, virtually. However, if you want to get this treatment, you'll have to find a practitioner that will provide the treatment, and it's called Acoustic Wave Therapy. There is another name for this type of therapy. It's also called GainesWave, if you've heard of GainesWave. It's also called Shockwave Therapy. Okay, and that kind of sounds scary. However, the shocks are very tiny. And what they do is they penetrate the tissue of the genitalia and the surrounding area, and they break up the blockages in the blood vessels and allow those blockages to flow away. Okay. And also over time, when you get multiple treatments, this treatment also increases capillary formation. And the capillaries are the teeny tiny blood vessels that go to all of the cells in your body. So every single cell needs blood flow in order to stay alive, right? Because the blood is what brings nutrients to the cells. So blood flow is extremely important for health overall in general to every part of your body. And, today we're talking about the genitalia, right? Blood flow is so key to the genitalia, because if you don't have the proper blood flow, you are going to not be able to get it up. You're not going to be able to have an erection. You're not going to be able to get engorged if you're a woman and have proper stimulation and wetness to the air, the surrounding tissue. So super, super important. I am going to be posting later today some pictures, or actually a video of me doing this treatment on one of my patients. That way people can see exactly what the treatment is all about. It's very similar to if you've ever gotten an ultrasound, where they put ultrasound gel on the area and then it's a wand, just like an ultrasound wand, but it's specifically designed for either, there's different wands designed specifically for the penis, and then specifically designed for the vulva and clitoris and a vagina. And so I will be posting a video, that way you can see what it looks like. But basically, the wand is moved along the tissue of the penis, the shaft, the head of the penis, the thighs, the top of the base of the penis, and then the area, that's kind of part of your abdomen. So I really try to encompass all of the area surrounding the genitals. Also, the perineum is also treated because we want the blood vessels to be open and flowing, the blood flowing to the genitalia from all directions. So that is the type of treatment it is. It takes about maybe 15 minutes for the treatment to be finished. It's not a very long treatment, but it's a very effective treatment. And what I absolutely love about this treatment is that 100% of the time, when I treat a man for erectile dysfunction, he always walks away and is able to see some positive changes within that day. Oftentimes it will be multiple erections throughout the day, which is absolutely normal. It's normal to have multiple erections throughout the day. So one of those symptoms of erectile dysfunction is when you start to lose those daily erections that are spontaneous and just come up throughout the day. And if you remember being a teenager, you'll remember that, you had spontaneous erections all the time, right? The wind would blow and you would get an erection. And that's normal function. So if you don't have that anymore, you've lost some of your normal function, okay? And you're not alone. And I'm going to bring up some statistics here. 20% of men in their 20s have some form of erectile dysfunction, and it goes up 10% per decade. So 30% in their 30s, 40% in their 40s, 50% in their 50s, 60% in their 60s. So it becomes very prevalent as we get older, right? And women have the same condition. As we get older, we become drier and drier, and our sensitivity decreases because we're having decreased blood flow. So increasing that blood flow is so, so important. Okay, and so the treatment, once the wand is moved along the shaft of the penis and all around the surrounding tissue, then you will start to see some blockages being, flow. The blockages flow away in the bloodstream and get processed out of your body. And you start to see some positive changes. And it's really remarkable to see the changes. I've seen some clients go from having erectile dysfunction for many, 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 many years, to suddenly having, spontaneous erections, morning wood. Morning wood is one of those things, right, that a lot of men experience. And, when you remember being younger in your teenage years, you had lots of proper blood flow. And so every morning you would wake up with an erection. It's very, very common to have multiple erections throughout the evening and night as you sleep. And that's a completely normal function of your penis. Now, if for some reason that is not happening anymore, it could be related to your diet. So let's talk about diet a little bit here, because diet is so incredibly important to erectile function, and to our health in general, right? So 70% of health is nutrition. And a lot of times people think, oh, I got to go work out. And yes, working out is absolutely super, super duper important, right? I'm sorry, it's 80%, not 70%. So 80% of health is nutrition and your diet. So what should we be eating in order to help that blood flow? And number one is fruits and vegetables. Fruits and vegetables are key to cleansing out those blood vessels and keeping them squeaky clean so that they can continue to allow blood to flow through them. So, what blocks our blood vessels? So, mainly the things that block our blood vessels are foods with cholesterol in them. Cholesterol is the main culprit of blocking our arteries. So, getting your cholesterol checked on a yearly basis is super, super important to making sure that you are keeping your good cholesterol high and your bad cholesterol low. And I was just talking on another podcast actually this past week with Amita Sharma, who was talking about, how oftentimes we go to doctor's offices and they will say, oh, all of your lab work is normal, right? Um, but if you're having issues and you're going to the doctor's office to get blood work to find out if there are any problems with your blood work, in order to help you solve your issues, don't take the doctor's word for it. If they say, okay, everything just looks normal, have a nice day, and they try and hang up the phone, really try to ask more questions, because unless we are advocating for our health, and I'm talking about very specifically advocating for our health, asking for specific testing, and insisting that the doctors listen to us, right? Because oftentimes we will, have a concern, and the concern is not taken seriously, or it's sort of brushed off because doctors a lot of times don't have enough time to really sit and look at you as a whole picture. So you need to paint the picture for the doctors. So, for instance, if you go in for lab work and they say everything is normal, take a look at your labs. Go into your portal and open up the lab work. And oftentimes, what you'll find is that you may be on the low end of normal or on the high end of normal. And sometimes that can even cause issues. So, really paying attention to your blood work is so important to really taking care of your health. I mentioned earlier 80% of health is nutrition. So, fruits and vegetables are key. And unfortunately, the average American eats 1.5 servings of fruits and vegetables daily. 1.5 servings. And a serving is the size of your fist. So, everybody is different. Everybody has a different serving size because we're all different sizes. But 1.5 servings of fruits and vegetables is not enough. Most people need 10 servings of fruits and vegetables daily in order to be healthy. And if you're not having that many, you need to do something to bridge the gap. What I like to recommend to my clients that come to see me is a product called Juice Plus. Juice Plus is encapsulated produce. It's basically produce that's been dried and encapsulated, and it gives you the nutrition of 30 fruits and vegetables in your body every single day. It's an incredible product. I've been using it for many, many years. I've found so many different health benefits along the way that I'm not going to get into right now. But one of the things that did really affect me when I started using Juice Plus on a regular basis, and this is when I was having my periods, and now I'm sort of perimenopausal, but I was having my periods at the time, and I always had extremely painful cramps. And one of the things that it helped me do was decrease the inflammation in my body. And it has been proven to do that in multiple studies. There are over 40 studies on this product. And it does help decrease your systemic inflammation. And so for me, what it helped me do was decrease my cramping when I had my periods. And when you think about cramping, you think about bloating, and bloating is basically just inflammation, right? Inflammation in your uterus, right? So if you're decreasing the inflammation, you're going to have less cramping. So that was a huge find for me. And I love to share about it because it's just such a great way to bridge the gap between what you do eat and what you should eat. And all of the things that I talk about today, you can find on my website, pleaseme.online. You can go on there and peruse all around. I have lots of amazing things to share on that site, but I'm going to be talking about some of those things today. Juice Plus is one of those things because nutrition is 80% of health, and we all want to be healthy. We all want to be the healthiest version of ourselves so that we can live well into our 70s, 80s, 90s, and beyond, and still be sexually active, right? And still have an amazing sex life. That is my desire for everybody that's listening today. So Juice Plus is one of those really incredible things. We were talking about wetter sex a little while ago, and we were talking about blood flow and how the vagina, clitoris, and the vulva needs to have blood flow, because when the blood flows to that area, the plasma seeps of the blood. The plasma is the kind of the clear part of the blood, right? It seeps through the walls of the vagina, vulva, and clitoris, and it wets the vagina. So blood flow is key to vaginal health and good sex. So absolutely super duper important. Another thing that I recently started doing, which I think is really exciting, and I don't know if anybody listening right now, I'm sure you has visited a physical therapist in the last year or two. And one of the treatments that physical therapists do is called dry needling. Dry needling is sort of like the Western equivalent of acupuncture. And if you love acupuncture, you will also love dry needling. And I have been treating patients with dry needling specifically for the treatment of erectile dysfunction and decreased vaginal sensitivity and dryness. And it is also a super effective treatment as well. It does also enhance blood flow. And if you know anything about acupuncture, it's really about connecting everything together and allowing things to flow, right? And if you have blockages somewhere, you're going to not have that energy flowing throughout your body. So we really want to get all of the energy flowing, and the blood flowing, because the blood is really the elixir of life in our body, right? As soon as the blood stops flowing, our hearts stop and we die. So we need the blood flow in order to be as healthy and as vibrant as possible. So that is super important. So acoustic wave therapy is the gold standard in treatment for erectile dysfunction and decreased vaginal sensitivity and dryness. And an adjunct treatment is the acupuncture, or it's called dry needling in the Western world, which is something that physical therapists can perform. And it's really, really wonderful for a whole host of different issues. If you're having surgery, it can help you with, improving the recovery time of surgery. It's great for pain management. There's just a lot of different treatments that can, dry needling can help. So just out of curiosity, has anyone listening received dry needling treatment? And yes, boner pills. Someone mentioned boner pills, right? And we're talking about Cialis and Viagra. So Cialis and Viagra really remarkable because they really do work, right? You take a pill and everyone wants a quick fix. And what's wonderful is that they can really give you, a jump start to your erection in the moment. But the problem is that over time, they can cause damage. And not only that, but because you're opening up the blood vessels, right, in order for the blood to flow, if you have a heart condition, oftentimes you can, a clot can form. And when you open those blood vessels, it can allow that clot to kind of travel through your blood vessels and give you a heart attack or a stroke. So, when you take Cialis or Viagra, you are predisposing yourself to an increase in heart attack or stroke. Did anybody know that? Because the doctors never tell you the side effects of that, right? But erectile dysfunction is a precursor to heart disease. So if you're experiencing erectile dysfunction, I always will tell my patients to also go see their cardiologist or schedule an appointment with one if you don't have one, because you want to make sure that your heart is healthy, so that you can live many, many years to come. You don't want to have, an experience where you take a Viagra or a Cialis and you have a heart attack and that's the end of you, right? And a lot of times people are not thinking about the side effects of this type of medication. Those are very serious, dangerous side effects. So instead of just treating locally the issue, and what happens over time too is if you're taking Cialis or Viagra, it might help at first. But if you continue with the diet that you're eating, and you're not looking at the cholesterol laden foods that you're putting in your body, your blood vessels can become more and more and more and more clogged. Okay. So if you get more and more clogged, what's going to happen? The Cialis and Viagra are no longer going to work anymore. So they might work a little bit at first. They might work great at first, but over time, they're going to lose their ability to work for you. So really trying to target the cause of the problem is what I do in my practice, with acoustic wave therapy, because that gets to the root of the problem, which is the blockages in our blood vessels. So we want to make sure that we keep those blood vessels clean. And one of the things that I talked about is diet. And Juice Plus helps you get the 30 fruits and vegetables in your body every day to help keep your endothelium, which is the lining of your blood vessel, squeaky clean. It's very, very important. Okay, somebody asked about edging. Edging, I think, is a great practice to help to teach a man how to control his erections and his ejaculation, really, to control his ejaculation. Like I mentioned before, premature ejaculation is a precursor or a symptom of erectile dysfunction. So if you're having premature ejaculation, and it typically, and it's caused by a physical issue like blockages in your blood vessels, edging is not necessarily going to help that. Okay. If you have healthy erections, edging is going to help you to be able to control your ejaculation, which is essential when you're trying to pleasure a partner, right? Because if you ejaculate in 5 minutes or less, it's not going to be as pleasurable as if you can last longer. And I mentioned before that women need 20 to 25 minutes of genital stimulation in order to even be ready for penetration. But women can last much, much longer than men and need much, much more stimulation in order to reach orgasm. So let's talk about orgasms, because I think it's important for people to understand. Hold on, let me grab my coffee here. My throat's getting dry. So I think it's really important for people to understand that orgasms for women and men in heterosexual relationships are not equal, okay? And that's something called the orgasm gap. The orgasm gap is a phenomenon in which in heterosexual relationships, women are having much less orgasms than men. And that goes across the board from hookups all the way to marriage and every other relationship style in between. And I will say here that the LGBTQ community and often the kink community doesn't experience this as much as others, because they talk a lot about what works for them, what doesn't work for them. And so really everyone should be having these conversations as to what works for you and doesn't work for you. Because if you're not having these conversations, you're not going to be able to get your sexual needs met. So how do you open up these conversations? And I talk a lot about this on many different episodes in my podcast. So I urge you to go back and listen to Please Me podcast. It's on Apple, Spotify. On Spotify, I now have the video available, which is exciting. It was on YouTube before, and it still is on YouTube, but it's now on Spotify as well. They have a video option, so you can watch my videos there. I also have all of my videos without any ads, and I early release my videos on Patreon. So you can become a member and get ad-free listening and early releases there. I also have a whole bunch of other stuff on Patreon that I won't go into right now, but my webinars are there. And so it's really a great place to go to get more education. Let's see, what else do I want to talk about? Oh, okay. So another thing that I want to mention too is our stem cells. So if anyone, and stem cells are something that have been in the news a lot lately, but stem cells are the precursor to every cell in our body. So every single cell starts as a stem cell. And over time, as we get older, stem cells become less functional. And so you're not able to turn over your cells as quickly. And all of the cells in our bodies need to be turned over in order to have healthy tissue. So for instance, and I like to use this example because it's one of the shorter ones, our taste buds turn over in 10 to 14 days. So the taste buds that you have in your mouth right now that are functioning right now, in 2 weeks are going to be brand new taste buds. And in order for all of the blood vessels, or I'm sorry, not blood vessels, in order for all of the cells in our body to turn over, it takes about a year. So, thinking about long term, we want to eat healthy for, regularly, most of the time, right? In order to make sure that our cells are getting the proper nutrition in order to function properly. So stem cells are something that are really important. And like I said, as we get older, the ability for our bodies to produce our own stem cells decreases. So there's a product that I also recommend. It's called X39. You know what? I should show you what it looks like. I'm just going to grab it over here. Hold on just 1 second. Stay right where you are. Don't go anywhere. Okay. All right. Okay, thank you for your patience there. So X39 is an incredible product, and it is incredible technology that has been developed over the last, 50 years or something. It's a product called LifeWave, and I'm just going to show you the package here. X39 is the one that helps your body to produce more stem cells. And, as we get older, our ability to produce stem cells decreases. So this is really something that can really help you to increase your stem cells in your body so that you can have generally health from head to toe. One of the person who introduced me to this product said that it should come with a warning label because she found that the women that were using it were saying that their husbands were chasing them around after starting using that after they started using it, because they were chasing them around the house to have more sex. So it definitely helps with libido. It helps with sexual energy as well. And it's not really uh, you know, marketed for that. Okay. But, the side note is that it really does help. And it comes in a patch form. And I already have the patches on, but because I wear a whole bunch of them every day. But it's just like a sticker, and you just like stick it on your body, and then it helps you to create those stem cells. And it's a whole technology that I'm not going to go into right now, um, the way that it works, but it basically triggers your body using um, a light wave, the light waves that are coming from your body. So it senses the light waves that are coming from your body, and it triggers a response in your body to create more stem cells. So that's how that works. And what's amazing about LifeWave is that there's multiple different patches that you can get. So the X39 is really amazing for the stem cells. Okay. There's another couple of ones that I really use a lot, and recommend a lot for my patients, because as a physical therapist, I treat a lot of people that have pain and inflammation. And like I said before, inflammation is really important to keep down in our body, because inflammation is the precursor to every single disease. So every disease starts with inflammation. So you need to be able to keep that inflammation down in your body in order to stay healthy. If you have high inflammatory markers, it's very important to bring those inflammatory markers down. So there is and I don't have it here. I think I have it upstairs because I used it this morning, but let me see. No, but there's another patch called Eon, and it's spelled Aeon. And again, all of this information is on my website. If you go to pleaseme.online and you go to my affiliates, you'll find LifeWave, and you can click there. Also, if you're interested in ordering it, please reach out to me, because I have the ability to help you get discounts. And so I can help you to order it in a way that you can get discounted rates. So just putting that out there if you're interested. I also use a whole bunch of other ones. The X49 is also amazing. The glutathione is also amazing, great for when you're recovering from sickness. It's a detoxification patch that's really great. And so we are always trying to detoxify our bodies, because we live in toxic environments, right? And so all of that toxicity can stay in our bodies and cause havoc in our bodies. So becoming, detoxing is so important. I really love the energy enhancer too. That one just, gives you a boost of energy. There's multiple other ones. Maybe I should do a talk just on these, because, I could really get into a lot of details about all of the different ones and what they do. And I'm not going to do that today. I just wanted to mention the X39, and especially that one, and the Eon, because the Eon, if you have erectile dysfunction or you have decreased vaginal sensitivity and dryness, that's already a condition that goes hand in hand with inflammation. So we want to make sure that we decrease the inflammation in our bodies. So that is very, very key, which is why I recommend it oftentimes to my patients, because it does go hand in hand with treatment of erectile dysfunction. And it is part of my protocol for both erectile dysfunction and decreased vaginal sensitivity and dryness, as is Juice Plus. So with all of that being said, I have been going on and on and on and on. So I want to just go back to the chat, and let me just go back and read it. If you can just give me a second, and see if there are any other questions that I can answer along the way here. So my profile is Please Me. So yes, you can find my profile and reach out to me on SDC. So yes, I do have a profile on SDC. Okay, West Palm Beach, Atlanta's in the house. My sound has a lot of static. Does it still have a lot of static? Because that's terrible. I didn't realize that, and I hope that you. Okay, no, it's fine. Okay, connection. Toronto, welcome, Toronto. Okay, let me just see. I just when you add chat while I'm reading, it kind of it moves. So hold on, don't say anything. Just a second. Let me read this. Hold on. So sound is working. Okay, perfect. Hello from West. Okay, this is where I was. You guys keep adding stuff. Belgium. Hello, Belgium. New York. Hey, New York. I lived in New York for many, many years, and I'm in Florida now, but I love New York so much. Beet juice. Beet juice is amazing. Beet juice is so good for your blood. Absolutely, beet juice. Capsules. I've never tried the capsules, but Juice Plus has beets in it, so those are the ones that I use. Juice Plus comes in capsule form. It also comes in chewable form, and I prefer the chewables. Excuse me. I prefer the chewables just because I don't like to take a lot of pills, and I already take so many because I like supplements. So I take vitamin D and I take probiotics, all of these in capsule form. So, in order for me to swallow down all of those capsules, I use actually the Juice Plus chewables, and I chew it up, and then I put the capsules inside my mouth, and then I swallow it down. It just makes it so much easier. Yes. So we were talking about cholesterol and erectile dysfunction, John. Okay, so let's see. Excuse me. Okay, let's see. No sound. I hope you can hear me now. The home units are not as powerful. So, if you have mild erectile dysfunction, I might try it. But if you really want to get a good treatment, I would go see a practitioner. Of course, if there's no practitioners in your area, because there's not a lot of people that actually do this type of treatment, then the home model would be a good place to start. And so, absolutely, give it a shot and tell me what you think. I'm trying to go back, and people keep adding to the bottom. So hold on, don't do anything just yet. Okay, I think I read everything. 95% of women need clitoral orgasm. So clitoral stimulation in order to orgasm. Okay, so not necessarily clitoral orgasm, although when you think about orgasm and a woman, when a woman has an orgasm, let's put it that way. When a woman has an orgasm, the part of their brain that actually lights up, okay, when the orgasm is happening, is the area that is associated with clitoral stimulation. So even if you're stimulating the woman on the back of her neck, she's perceiving it as sexual stimulation. If you're stimulating a woman on her nipples, she's perceiving it as sexual stimulation. So all of that goes straight to the brain and the clitoral area of the brain. So a lot of times people will talk about different types of orgasm. All of those orgasms are felt in the body differently because they're being stimulated in different parts of your body, but they are all going to the same part of the brain, the clitoral area of the brain, and that's what's lighting up. So the clitoris is the female equivalent of the man's penis, and it's extremely important to be stimulated during sex for the woman to have an orgasm and to enjoy herself. So never skimp on giving clitoral stimulation. The vulva, underneath the vulva, are the clitoral legs. And the clitoris is actually almost the size of a penis, even though what people think of as the clitoris is that little nub on the outside of your body, right? On the outside of the woman's body, and it's very small. So comparing that to the penis, it's literally like, a teeny tiny little thing comparing to the man's penis, right? But when you look at clitoris, the entire clitoris is almost the same size as the man's penis. And it's internal as opposed to external. So we don't see it as much, but it does need to become engorged, and blood does need to flow to it in order for a woman to be properly stimulated in order to have an orgasm. So knowing that is so key. And let me just see where my little model is. Do I have it here? Well, my clitoris walked away. I don't know what I did with it. I have a little model of a clitoris that I like to show, but it's not on my shelf right now. So I must have moved it to do a presentation, and I forgot to put it back. But look it up. Go to Google and look up, models of a clitoris, and you'll see how big the clitoris actually is. And it's really a remarkable part of a woman's anatomy. And it's a beautiful thing. So make sure that you're stimulating it as much as possible, ladies and men. I always say that women should really learn how to masturbate and learn how to come on their own, learn how to orgasm on their own. Because if you don't know how to do that, you're not going to be able to translate that information to the bedroom or teach your man how it works for you, right? Because every woman is different. Every woman is going to have slightly different way of orgasming. And so you want to be able to translate that information and communicate that information with your partner or partners. So masturbation is so important. And we were talking about edging earlier. Edging is a great way for men to learn how to last longer so that they can, have more extensive sexual experiences. And I think edging is a great tool to use. But women need to masturbate as well. And, we just passed November, and, there's this whole thing about No Nut November and how you should hold off and not have any orgasms in the month of November, which I think is the most ridiculous thing I've ever heard in my life. Having regular orgasms is good for your health. Okay. So holding back on that is never good for your health. And the reason why for men specifically, having regular orgasms is important, and I'm talking about either masturbation or penetration, either one, ejaculating, is because when you ejaculate 22 times per month or more, you decrease the risk of prostate cancer. So regularly having orgasms and ejaculating is super, super important for our health. Okay. And you heard it from me. So, don't skimp on the masturbation, and don't hold back your cum for one reason or another. I know sometimes I've heard men say that they want to save it up for, a partner or whatever, but that is absolutely not necessary. So, regular orgasms, regular ejaculation is really good for you. I believe the Trimix is the injection, right? That you inject into your penis. I believe that that's what that's called. I don't know if I've heard of the Bimix, but I think the Trimix is the injection that you inject into your penis to make it hard. Again, I've heard nightmare stories where the injection causes a hard-on that just doesn't want to go away. And then you have to go into the emergency room and have it drained, and that can cause permanent damage. I don't recommend these types of dramatic things. I really think that treating the root of the problem instead of trying to get a quick fix is going to be a better solution. Of course, everyone, has to take these, make these decisions on their own personally. But I do not recommend Trimix. I also don't necessarily recommend Viagra or Cialis. I think that if you get to the root of the problem, you open up the blood vessels, and we're talking about the physical manifestation of erectile dysfunction and decreased vaginal sensitivity and dryness here. So if you're focused on, opening up those blood vessels and allowing the blood to flow, you're not going to need the Trimix or the Viagra if you're treating it that way. Party for three. all of the products that I recommended today, okay, and the ones that I talked about today were Juice Plus, and I talked about LifeWave. Those are the two things that I talked about today that I recommend as part of my protocol for these conditions that I treat, okay? And you can find them on my website at pleaseme.online. When you go to pleaseme.online, you have to be 18 or older in order to enter my website. You just say that yes, you are, and you can go to the affiliates link. And when you go to the affiliates link, there will be all of the links to all of the products that I recommend, two of which are, one of is LifeWave, and then the Juice Plus is in a different tab. So you'll have to find that in a different tab once you open up the website. And so look at the top, and there's another tab, and there's a whole bunch of videos on Juice Plus. There's also a free cookbook for making smoothies and for making energy balls. If you guys like those, I really think that they're a great snack. And they're really healthy and a great way to incorporate like really healthy things into your diet. So you can find those things on my website. Are you talking about matcha tea or maca? I'm not sure what maca is. Matcha tea is very good for you. Definitely incorporating matcha tea into your body is really good. Horny goat weed powder. So I had a woman on my show. Here she is right here, Adriana Grayson. Okay. Here's Lexi Silver, by the way. Lexi was on earlier. She's the SDC coordinator, media coordinator, and she is incredible. She's been on my show twice. But if you follow Adrienne Grayson, she talks about all sorts of herbs to use in order to improve your genital health. And that is really her specialty. She's incredible. And she does talk about horny goat weed. I like to talk about watermelon, because watermelon really has the properties of Viagra and Cialis, but in a natural form. So I like to talk about doing a watermelon challenge for a week and having 4 cups of watermelon every single day for a whole week, and then checking back and seeing how your erectile function or wetness and sensitivity are affected by that watermelon challenge. So try that, because watermelon has a product or a natural, what am I trying to say? It's called citrulline. It's a, oh my gosh, it's a nutrient called citrulline. And citrulline opens up the blood vessels in our body just naturally, just like Viagra and Cialis does. So give that a try. And if you do, please reach back out to me and tell me how that went. But yes, horny goat weed is a really good herb, and there are many others. Okay, that I suggest you check out. Adrienne Grayson, she's incredible, and she has created some products that are specifically designed for erectile function. So she's incredible. She's a lot of fun. Prostate massage is also great and feels amazing for those men who love that. And so I think that there are health benefits to it. I think we've run out of time, but I definitely appreciate that question, and we'll definitely address it again in the future. But yes, prostate massage, I definitely recommend. And my site is pleaseme.online. Oh, okay. Maca is a Peruvian root. I'm going to have to look a little deeper into that one. I'm going to write it down and look into it. But when we talk about nutrition, fruits and vegetables and natural products like herbs are so important. This is what our bodies are meant to eat, right? We're not meant to eat processed foods that come out of a box. We're meant to eat fruits, vegetables, herbs, grains, legumes, root vegetables. So all of these things are so good for us. That's where all the nutrition is in our diets. And if we're not getting enough of that, we are not going to be as healthy as we can be. So pleaseme.online, ONLINE, pleaseme.online. Oh, yay, Lexi, you're on my wall of infamy. um, and again, my name is Eve Hall. My podcast is called pleaseme.online. I'm sorry. My podcast is called Please Me. Okay, just please me. And I would love for you to listen to my show. Please support the show. You can go to Patreon and become a subscriber there. And, my show is a wealth of information. I think we are out of time now, but I would, love to answer any other questions that you have via Messenger. So feel free to just message me on stc.com. And happy to answer any questions that you have further. Okay, just finished reading all of the messages, and thank you guys all for being here today. I appreciate you, and have a fantastic holiday season. Oh, and if you're looking for a special gift to give your lady friend, I personally have found that that cakes are an amazing gift. And I'm going to show you mine today. I have the round ones on today, and this is a cake, okay? And I stopped wearing a bra during COVID, and I never went back. And so I found cakes, and cakes are non-adhesive, so there's nothing sticky on it, right? But it adheres to your skin naturally, and it just takes that little nipple coverage, and sometimes you want to show that off, but sometimes you want to cover it up. So you just put that cake on, and it just stays adhered to your skin, and it allows you to be braless and still look really nice and smooth in your clothing. So great gift for the holidays as well. So with that being said, I'm going to say goodbye, and until next time, everybody, have a great day.
Hey, I have a personal question to ask you. Are you experiencing vaginal dryness? Are you looking for an all-natural lube that helps you get the juices flowing? I will give you a tip on what I use. I use Bonnie's Herbals. I use the sex butter for those intimate moments, and I use the boudoir butter for my everyday moisture. And these have been game changers for me. So check out the link in the show notes and get yours today.